Hi, everyone. Welcome. We're going to go ahead and get started we'll give it just another 30 seconds or so for people who are running a bit late or coming from another meeting, and then we'll get started. All right. Well, I think we'll go ahead and get started. We are recording this so people who are late can watch back later. But thank you so much for being here. I am Megan Seawald, the manager of the Data and Design Core at the Eisenberg Family Depression Center. We are so excited to welcome you to the third and final session of this webinar series, Secondary Data Deep Dives, High Impact Options for Mental Health Research. If you've been at our other sessions, welcome back. Today's session is focused on the National Health and Nutrition Examination Survey, or NHANES. And our panelists today are Dr. Brianna Mezek, our Data and Design Core Faculty Co-Lead and Professor of Epidemiology, and Dr. Kyun Park, who is also a Professor of Epidemiology. And we're very excited that they are both here today to be able to share their experiences and knowledge working with this data set. I also have our other Data and Design Core team members on the call, Sarah Stoddard, Associate Professor of Nursing, and Emily Urban-Wojcik, our team statistician, who's also worked with NHANES. So you may see them helping to answer some questions in the chat and weighing in the discussion. A few brief Zoom reminders before we get started. This is a Zoom webinar, meaning you'll be on mute and off of video for the entire session. So you can feel free to make yourself comfortable, grab some food, use the restroom, whatever you need to do during the session. We will not be able to see or hear you. Closed captioning can be enabled at the bottom of your Zoom screen if you desire. We will try to save about 5 to 10 minutes at the end of the session for questions and discussion. You can feel free to submit questions throughout today's talk using the chat or the Q&A box, and we'll get to those at the end. And then finally, as I mentioned, the session is being recorded, so you don't have to worry too much about taking notes. We will send out the recording and the slides and a couple of additional resources in the next few days as a follow-up. If you've already joined us before, you have heard me say this, but if this is your first time with us and you're not familiar with the work of the Eisenberg Family Depression Center, this is just a brief bit of context about what we do. So the mission of the center overall is to improve lives and empower communities through bold innovations and interdisciplinary collaborations across research and outreach that advance how we understand, treat, and prevent depressive illnesses. And under that larger mission, the goals of our program, the Data and Design Core, are to reduce barriers to academic research so that investigators can generate impactful, innovative research more efficiently, and to support emerging scholars so that they can build robust long-term research careers in the field of mental health. And the key mechanism that we use to achieve those goals is leveraging secondary existing data sources. And we operationalize that through supportive programs, educational sessions like these webinars, to make more investigators more aware of high quality data, resource development to show you how to use these data sources and more. And I'll say a little bit more about how you can get more support from our team at the end of today's talk. So this series is meant to be a deeper dive into specific data sets that we're featuring and to provide actual use cases so that you can provide better understand their application in different settings. So we hope that you'll walk away from today's talk with an understanding of both why you should use this data set in your research, so the value and the capabilities of the data set, and then how you can actually get started working with the data. Today, Dr. Park will cover at sort of a higher level the goals of the study population and study procedures, what kinds of information and measures are included in the data set, how to get data access and what parts of the data are restricted, where to find some example code and some considerations to think about in your statistical approach, and some example papers and projects to show you how you can use the data set in practice. And through that, you'll understand what's possible with the data set and some of the strengths and drawbacks of working with the data. And then Dr. Mezek will walk through the mental health and depression specific measures that are available in this data and share some example projects and papers that are using those measures. And we'll have time for questions and discussion at the end. So with that, I will hand it over to Dr. Park to get started.
Thank you, Megan. Hello, everyone. My name is Kyun Park. I'm a faculty member in epidemiology at School of Public Health, and it is my pleasure to share my experience of using this NHANES. This is because, when I began my career, as a faculty member, and I need some preliminary data to propose a new study. And at that time, so NHANES was a great resource to get started. And so that's why the you also will find NHANES is a really interesting and useful data sources that can support your future research. So today's this presentation does not contain a very specific technical, like a statistical part, but more likely my goal is to help you get started. Next slide. So as Megan mentioned, that so NHANES is a cross-sectional national survey, and it began around 1960, and at that time, this national survey more focused on just health examination and did not include nutrition component. And starting from 1971, so nutrition component was added and became NHANES. And since 1999, so NHANES has been conducted without any interruption. So we call this is now the continuous NHANES. So for this continuous NHANES, each year about 5,000 adults and children. So that's why this is a 2 year for each cycle. So that's why each cycle include about 10,000 individual. And the unique feature of this NHANES compared to other national surveys that this is the only national survey including this health examination as well as a laboratory test for participants of all ages. So I will cover more details about what kind of data included in this one, but briefly, so this NHANES contains this interview, lab tests, and examination data. Next slide. So who are in NHANES? So when you begin a study, it is important to understand who are in your data set. And so this is a national survey data. That's why each cycle contain a US representative sample. So then, how can we ensure this is a representative sample? Then we have to use like a random sampling. But because US is geographically too wide and dispersed, and this is why just random sampling is not a useful sampling design. So that's why we are using this complex sampling design. So this complex sampling design has a two component. One is a multi-stage sampling. Another one is oversampling. And multi-stage sampling, actually, it has 4 stages. So the primary sampling unit is a county. So out of over 3,000 county, and each cycle, they select about like 50 counties. And then for this randomly selected county, and then census group as a segment is the second stage. And then also household are also randomly selected from the selected segment. And finally, at least one individual from selected household will participate in NHANES. Another feature is that because it is important to produce accurate and reliable representative statistic even for a small minority group. So this is why children and adolescents and ages 60 and over, and racial and ethnic minority group, so including African American, Hispanic, and Asian, are oversample to ensure that any statistic for even this minority group can be accurate and reliable. Next slide. So this two table compare, you can see the age distribution and the race ethnic distribution between a sample and then population. So sample means that if you look at just NHANES sample, then what is the age distribution and race ethnic distribution? But actual age distribution in US population is the next column. So age distribution, you can see sample, so NHANES sample more represent this the oversample, this young children and ages 60 and over. And then race ethnic group, Mexican American, other Hispanic, non-Hispanic Black, and non-Hispanic Asian oversample. So that's why you can see higher proportion compared to the population actual distribution. Next slide. So this means that, so when you analyze this NHANES data, if you don't account for this complex sampling design, then your statistical estimate and the inference can be in trouble. So if you ignore this multi-stage cluster sampling, then, from your statistic 101, and you learn about what is the regression assumption. And one of the important assumption is like an independence assumption. But because the people from the same, for example, same county or same the census group, more likely they are more similar compared to two individuals from one county versus another county. So that's why independence assumption can be violated. So that's why we have to account for this the cluster sampling. So if you ignore that, then your standard error can be underestimated, which lead to this invalid statistical inference, mostly false positive chance can increase. So another feature is the oversampling. So that's why if you ignore the sampling weight, then because your estimate is based on this overrepresented subpopulation, so that's why your estimate can be biased. Click one more. And that's why, in data analysis, you will need to account for this complex sampling design. And, most of common statistical program, including SAS, R, and Stata, so provide a survey procedure. And then, so you can properly account for this complex sampling design and make your estimate representative, and then your estimate can be generalizable to the US population. So more details about this high quality enhanced analysis and then data analysis tutorial, you can please go to this link and the website, and then you can find more. Next slide. So this is an example comparing, if you properly account for the sampling design, but another one is not accounting for, then what happened? So I am using this depression score, and I believe that Bree will talk more about this instrument and measure. So this is like a 9-item depression score, and which range from 0 to 27. So each one has like a 0 to 3, and then Likert scale, and then combined together. And unweighted mean depression score is a 3.24. And the prevalence based on score greater than equal to 10 is 9.1%. But after you are accounting for the sampling weight, and then you can see the depression score is 3.15, and then prevalence is 8.5, suggesting that if you don't account for this sampling design, then the prevalence of depression can be overestimated. So you also want to compare this prevalence by like sex or other variables. So in this example, comparing by sex, and then so chi-square in unweighted analysis is 14.7, and then you can see the p-value is really small. But after accounting for this, independence assumption, multi-stage sampling, and then chi-square value is 7.5. And even though both analysis, so our conclusion remained the same as like a p-value 0.05 level, but you can see the adjusted p-value is larger than this underestimate p-value. So that's why it is important to account for this sampling design. Next slide. So after you understand this, and then so where can you find the data? Then go to this NHANES website, and then you can see on the right side and the second from the top, and then you can see about the data. So one click. So then to download and NHANES data, then you need to go to this about the data. So next slide. But before you get there, so one thing that I strongly recommend is so take a look at this NHANES survey content brochure. So currently, the most up-to-date version of brochure contain the data from 1999 through 2021, 22. And why this is very useful, because there are each cycle is a 2-year, So this from 1999 through 2021, which means that now we have over more than 10 cycles of NHANE. So then the question is, which cycle should I look at? And each cycle contain different variable, and so it's unclear at the beginning. It's hard to determine which cycle you have to look at. So this brochure is very useful to guide and then what kind of data available and where this data, which cycle this data is available. And then, this brochure summarize this available data in table by this questionnaire, examination, and the laboratory. Next slide. So this is an example, and for example, depression. So depression was measured using depression screening instrument questionnaire. So that's why you need to go to this questionnaire table, and then as you can see here, there are several mental health variable, and then next column you can see sample description. So showing that the which sample eligible to have this assessment or questionnaire interview. And for depression screener, so the cycle 1999 through 2003 and 4, so it was interview in half sample for age 20 and 39. And then since 2005, you can see this green box. And then on the top, you can see this green box change from original sample description. So Megan, click one more. So and from this table, it's hard to understand what this change is. So that's why you have to go, so one more click, and then you have to go to NHANES website to understand sample description, so eligibility. So for this depression screener, since 2005, was measured for the participant age 12 and over. But because, so later I will talk about the limited data, but publicly available data is only for age 18 and over. Next slide. So then not only this depression from questionnaire, but also you also want to look at examination and other data. So for example, here examination, then you can see which cycle contain which examination variable. So for example, blood pressure or DEXA-based body composition. So then you find the right cycle and then you can design your own study. Next slide. And the laboratory is another example. So this laboratory contain several biomarkers for health. And like me, who is interested in environmental chemicals, so then this table also show what exposure biomarkers are available. Next slide. So then after you determine, okay, so which cycle is the right cycle you have to look at, then go to this NHANES website and then this data page. And as you can see here, so this data page contain, this multiple NHANES cycle, and each cycle has its own US representative population data. So you find the right cycle and then click that cycle, it go to, the right one. So click one. For example, here, so as I showed you before, so you are interested in depression from NHANES 2017 and 18, then click that, the link, it go to that specific cycle. Next slide. So when you click that, and then you can see the next page. This is like NHANES 2017 and 18. And as you can see here, demographic data, dietary data, examination data, laboratory data, questionnaire data, and then limited access data. And I will cover that part later. But most of this, the 5 sets of data are available, open to the public, and then you go there and then download the right data set. So for example, depression, so then you will need to go to questionnaire data. So one click. Then, so click this questionnaire data, next slide. And it goes to this questionnaire. So then you can see here, there are many, various types of this questionnaire: food security, health insurance, and housing characteristic, and so on. And bottom from third from the bottom, you can see this mental health depression screener. So one click. So that's why you will go there and then find this one. So one tip is that so the second column you can see this doc file. So that doc file is about like the data dictionary. So what kind of variables are available, and then what is the definition of variable, what is the distribution of this variable. So this doc file provides this whole data definition and other details. And then third column, you can see data file. So this data file as a XPT file. So all common statistical program can read this XPT file. So either SAS or R or Stata, there's a way to read this data file. So you download this data. And so this is a mental health data, but let's say you also need um, the like a demographic variable. So you need to go to the demographic page and then download the demographic file and then merge these two data to analyze the association between, for example, depression, prevalence by sex or race ethnicity. And then before we go to the next slide, then so on top you can also see questionnaire instrument. So I didn't include a slide to explain that one, but for those who are interested in how this mental health, for example, was assessed and then how the instrument looked like, then you can click there. Then you can find all this the instrument and the questionnaires are available, so you can download that and then you can see how each question was asked and then answer of were collected. Next slide. So NHANES also provide this sample code, and this is very useful for those who have never used NHANES before. So as a starting place, and then I strongly recommend go to this sample code. And when I checked this sample code a few days ago, and I found that this depression prevalence as an example, this sample code. So for the center member, this is a really good resources. So then you can see depression prevalence, and then in that column, so you can see this downloading and the importing data file using correct sample weight, and then only for the depression column, you can see four statistical programs, so SAS, Sudan, and Stata, and R. So depending on which program you are using, and then you click that, and then you can get the sample code, and then you can start from there. Next slide. Yeah, one more. So then if you click that depression, then you can see this is an example study. So prevalence of depression among adults aged 20 and over in United States from 2013 through 2016. And then this is a key finding from this analysis. You can replicate this analysis using that the sample code. Next slide. So from this report, and then one of the interesting finding is what is the prevalence of depression in this period? And overall, 8.1% of American age 20 and over had depression in this. So depression was asked about, like, did you, this 9 item and over the past 2 weeks period. And this visualization and graph also very useful because it compare men and women and the different age group, and we can see the women's prevalence of depression is higher than men. And then among men or women, you can also see which age group have a higher prevalence. Next slide. So another important and I think probably most important advantage of using this NHANES is to look at the temporal trend. So one of important question is whether or not depression in the United States has changed over time. So any medication use or any policy change, and then whether so how effective and of those policy change or any clinical recommendation initiated, and then what happened. So in this example, between 2007 and through 2015 and 16, so over this 10-year period, even though there is a little bump in 2013 cycle, but overall, there is no change in the prevalence of depression in the United States. Next slide. So that's why each cycle. So after you identify which cycle you have to look at, and then probably you also find the variable of interest was measured in multiple cycle. So then which cycle should I use? So in general, we recommend, look at the multiple cycle because as you see in the previous slide, so like in 2013, there was some bump in the prevalence. And so that's why if you look at only single cycle, because of this random variation, there may be some, the unreliable estimate from the single cycle. So by combining multiple cycle, you can obtain more reliable estimate, accurate and reliable estimate. And also for certain, small subpopulation, single cycle probably the number of cases is could be too small. So that's why by combining multiple cycle, you can get more reliable estimate. So then when you combine multiple cycle, you have to keep this in mind because each cycle represents US population. So, and then if you combine two cycle, and if you don't rescale the sampling weight, suggesting that you are actually looking at double of US population. So this is why it is very important to rescale the sampling weight when you combining multiple cycle. So failing to rescale sampling weight will result in overweighted estimate. Next slide. So another, advantage of using this NHANES is, even though this is a cross-sectional study, you can design prospective study if your interest is mortality. So this NHANES data and other national survey data linked to National Death Index. So currently, the NHANES, for example, NHANES 3 and the NHANES from 1999 through 2018 linked to this National Death Index data through 2019. So using this data, you can look at the association, for example, depression and mortality, and certain major cause of death data is also available. Next slide. So this is an example. So I look at the association between cadmium and mortality from influenza and pneumonia. And in this graph, you can see that, so we can compare, so low cadmium exposure versus high cadmium exposure, and then what is their cumulative hazard over time by age. And then clearly it suggests that high cadmium exposure is associated with higher hazard to develop influenza mortality. Next slide. So then, so you can design this, different types of study. And then another one is, as I mentioned before, so 5 sets of variable and the data open to the public, but there are other types of data that are not open to the public, but access to this data is limited. So next slide. So if you click that limited access data, then you can see what limited data is available. And this limited data access is only through National Center for Health Statistics Research Data Center, RDC. And this is because to guarantee this confidentiality of the study participants. So any sensitive data or any any data that is subject to this confidentiality issue, then this data access is limited. And one example is this mental health depression data for children. Next slide. So research data center is actually one of the federal research data center is here in University of Michigan. And so that's why the University of Michigan community and then the investigator can take advantage of this local access to this. And what restricted data is available? So geographic variable, so genetic data, and limited access data that I just show you. And then depression is one example. And another very useful this restricted data is Medicare claim or like a social security benefit. Next slide. And then, so I am an investigator who actually take advantage of this Medicare claim data. So I design, a study looking at this lead exposure and Medicare-based Alzheimer disease and all-cause dementia. And any other study it is very difficult to obtain and look at this Alzheimer disease and dementia, and also prospective cohort study and then observing this outcome takes very long time. But by linking this nationally representative population data to Medicare, you can examine this very valuable outcome. And in our study, I was able to secure, as you can see here, over like about 1,000, so 10,000 subject, and then number of AD and the dementia cases were also over several hundred to thousand. So the power was very high. And on the right side, you can see the association between lead and this Alzheimer disease. And we found that high cumulative lead exposure was associated with higher risk for developing Alzheimer disease. Next slide. So, this is my last slide. So, I include this enhanced resources and other sample code that I already shared before in the previous slide, but you can see these other, I collected all this, the link to this single slide. And so please use this page, and then you can go there and then use this enhanced data for your research. And also, if you have any question, today I will try my best to answer, but please use my email, and then I will be happy to answer. So I will turn it over to Bree.
Thank you, Kyun. There's a fantastic overview, and I think we'll have plenty of time for questions. I see some coming into the Q&A already, which is fantastic. So I just want to take a few minutes to talk specifically. Kyun already said a little bit about the measurement of depression in this data set, but I want to tell you a little bit more about that and just give you a few more examples to get you inspired to do some work. Next slide, please. And if you click through one more. So you've already got a great understanding of what NHANES is and how it's collected. And I want to tell you, even if you've never heard of NHANES, I guarantee you have encountered some of the findings from it, because NHANES is the data set that is used to generate, for example, growth charts for children. It's how we sort of determine what is normative in terms of like the normal curve of growth, for example, in the United States. It tells us the prevalence of things like high cholesterol, hypertension, obesity, because these are objectively measured. They're not self-report measured. Which is what most large surveys have to rely on, unfortunately, but these are objective measures. So it's not dependent on, does somebody go to the doctor regularly? Did they, get X, Y, or Z test done? It's really sort of everybody, as Kyun said, everyone who's selected for the sample gets all these tests. And it's really helpful for looking at trends in health behaviors and health status over time. So because the same types of measures are used every cycle. Next slide, please. So the measurement of depression, kind of mental health more generally in NHANES has changed over time. So for 3 cycles, so the year 1990, 2000, 2001, 2002, and 2003, 2004, NHANES included or assessed depression and a couple of other important kind of internalizing disorders, panic and generalized anxiety disorder among adults, using a fully structured diagnostic interview called the Composite International Diagnostic Inventory, or the CIDI. Now, the CIDI is one of the most sort of well-tested measures of essentially mimicking what a psychiatrist or a psychologist does in the context of making a diagnosis, but it is administered not by psychologists or psychiatrists. It's administered by lay people, the people who do the rest of the data collection for NHANES. And so it's really, it's a very complicated instrument, but what it gets you is a reliable and, again, an assessment of past year depression, past year panic, and past year generalized anxiety disorder that is consistent with the type of diagnosis that a psychiatrist or psychologist would make. For children, they used a different instrument, but a similar sort of structure, fully structured instrument, where there are measures of conduct disorder, eating disorders, and then as well, generalized anxiety disorder, panic, and major depression. Now, these instruments, as you've probably inferred, are because they're trying to mimic what a psychiatrist or psychologist does during the diagnostic process, are complex and lengthy. And as a result, just due to different shifting priorities, these are not used in NHANES anymore. But since 2005, the 2005 wave, or not wave, cycle, excuse me, NHANES has included the Patient Health Questionnaire 9, that is the full 9 items of the Patient Health Questionnaire among people age 12 and older. And this is administered using what's called an audio computer assisted interview. So in this, the way this is administered is the respondent or the participant is sitting in front of a computer, just like you're sitting in front of one now, and they're given headphones, and the headphones read out the questions to the person. So they're sort of trying to that is, there's the interviewer is not administering it, so the computer is administering it. So it's meant to try to make people more comfortable in revealing information like depressive symptoms, which can be stigmatizing, and some people don't really want to share that out loud. So they don't have to share it out loud. The computer asks them the question, and they can just type on the screen what the answer to that is. If you could click through one more time, please. The other set of variables that NHANES, again, continues to collect that are relevant to kind of measures understanding of depression, it does collect information on not just antidepressant medication use, but all medication use, but it does have information on antidepressant use. It also has measures of tobacco and alcohol use, and as has already been addressed, good measures of BMI and physical activity. Next slide, please. So I wanted to share with you a few samples of my own work that has used NHANES, these depression measures from different years. So this is a study that I did with a colleague here at the University of Michigan, Belinda Needham, where she had data on telomere length that had which is a kind of measure in your cells of kind of how old they are, essentially. And what we were interested in is trying to understand to what degree did people who have a history of depression and anxiety, did their telomeres differ in length than people who did not. So if you click through one more time. So the short answer is that there was no difference. That's what's shown here on the bar chart. But one of the things that was really powerful is this is actually so you can see the sample size here of people who had these measures and had this telomere data. It's about 1,300 people. This represents one of the largest studies, at least at the time, that had ever been done on this question. And so you may know that small samples are much more likely to produce results that are not replicable. That's part of what having a small sample does, is that it's not as reliable. You don't have as much information. And so we were able to get this paper published in a very high impact journals, Molecular Psychiatry, even though it was a null result. So I just want to kind of encourage, especially our young people out there, to if your data is the best data out there to answer the question, even if the answer is non-significant, that doesn't mean it's not an important finding. So that's one example. Next slide, please. This other example, we go forward in time. Now we are using the Patient Health Questionnaire 9. So again, not the CD. This is because that was only in those earlier waves. This was a study that I did with Josh Montgomery, who at the time was a post-baccalaureate student with me at Virginia Commonwealth University. And he was interested in understanding the relationship between food insecurity and depression among adults with diabetes. What's really interesting about NHANES is that NHANES has the ability, because it collects blood, we can look at people who have diabetes but don't know it. Because for many people, it's asymptomatic, and unless they've kind of had a high sugar for quite some time, and identify people who have prediabetes, that is a state of sugar, kind of high sugar insulin insensitivity that doesn't meet the diagnostic criteria for diabetes, and which is if you looked in a clinic population, it would be very hard to find these folks because unless the doctor screened for them, it's completely asymptomatic. So you go to the next slide, please. Or click through. Yes. So thank you. So what we found, what we were interested in is trying to understand this kind of social determinant that is food insecurity. We had the psychological determinant of depression, which was our outcome. And we wanted to know, especially for people who are trying to control, potentially control their or manage their diabetes or reduce their risk of developing diabetes, that is people who have, prediabetes or type 2. Food insecurity is a really important thing to address because if your doctor tells you need to eat better, but you don't know where your next meal is coming from, that doesn't really help solve the problem. So this is just another example of where we were able to take kind of this data set and ask some questions that were really relevant to more of like the field of social epidemiology, because we were able to take advantage of the both the social measures of food insecurity, the biological measures, that is being able to identify people who had prediabetes or undiagnosed type 2 diabetes, and then the depression measure. Next slide, please. The last example from my own work that I'll share is using, more recent years of data. And just like Dr. Park mentioned, we concatenate these or append these years of data together so we can get more reliable estimates and increase the sample size. So now we're looking, depending on the biomarker that we were looking at, we had this study had a sample size of between 4,000 and 17,000, depending on sort of which biomarker was available at which cycle. Here, what we were interested is identifying people who had depression but did not endorse that 9th item of the PHQ-9, which is suicidal ideation, and people who did endorse suicidal ideation, even if they didn't otherwise meet criteria for depression. And we were interested in different measures of inflammation, including a dietary inflammation score. Next slide, please. Or click through, please. Thank you. So, what we found was that, people that both depression and suicidal ideation relative to people who had neither depression nor suicidal ideation were associated with higher levels of, in this case, this dietary inflammatory index. And so, again, just sort of illustrating the diversity of questions that you can ask using these data that are relevant to depression, because the PHQ-9 includes every item is asked of every person. It doesn't matter if you told me no to the first 8 items. If you tell me that you've been thinking about suicide in your last item, there's no skip pattern out of that, is what I'm trying to say. And so it really does provide, frankly, some of the best population-based data on suicidal ideation that we have in the whole US. Next slide, please. Now, this is not my own work, but these are just a couple of other papers that were published very recently. Again, just as Dr. Parks was published in 2026, just emphasizing that these are data that are used today in very high impact journals. So these are looking, for those of you who are interested in the genetic data. So both of these studies were using, the one on the left was using kind of polygenic risk scores for depression, and the one on the right was using a Mendelian randomization approach. Again, just kind of the fact that this data set can be used for these types of studies, as well as studies about food insecurity, and as well as studies about Medicare, utilization for dementia, is just illustrative. There you go, of the kind of diversity and breadth of projects that can be proposed here. I think that might be my last one. Might be one more. Oh, so. The last few things, again, you've already heard this, but just to remember, it's been running in its current form since 1999, but there are earlier versions of it going all the way back. Again, anyone is eligible to be selected, but again, Dr. Park already went over who's oversampled. Each cycle is about 5,000 people, but we typically concatenate or append those cycles to get a larger sample size and a more reliable estimate. And again, what makes this data set unique, and if you could click through one more time, Megan, please, is that it really does have, and one more actually, I think. Yep, thank you. It has this laboratory, that's a picture, as Dr. Park showed you that already as well, of the lab that people go to get their blood drawn, and all these other exams that get done. And again, as a reminder, these data, in addition to everything I showed you, that's not true. So the telomere data was data that were that Dr. Needham had requested those blood samples and had analyzed and had those blood samples analyzed in a lab to measure telomere length. And then those data got put back and attached back to NHANES. So you don't have to pay for that now. If you wanted to look at telomere length in NHANES for those years of data that she did, that's available to you now. And so that's one of the other just real benefits of being able to use a big nationally representative data set. It really is a resource for every scientist out there, even if you don't have millions of dollars of grant funding available to you. I think that's my last slide. Thank you.
Yes, thank you both so much. Really fantastic information, great examples, so very, very helpful. We will get to questions and discussion in a moment. I see a couple of folks have put questions in already, so feel free to do so, and we'll get to those in just a second. But I do want to leave folks with some other resources and ways that they can engage with our team if you're looking for more support. So as I mentioned, this is the third and final session as part of this series. There have been 2 other earlier sessions. The first was on the Adolescent Brain and Cognitive Development, or ABCD study, which is the longest long-term study of brain development and child health in the U.S., a longitudinal study that's tracking the development of almost 12,000 adolescents and recruits from 21 states across the country, including right here at U of M. And then our second session from last month was on the Health and Retirement Study, U of M's landmark longitudinal study on aging and well-being. So both of those recordings are available. I can send around those links with our follow-up, and I would highly recommend you checking them out if you haven't done so already. If you're new to secondary data in general, and some of this information is feeling a little bit new or overwhelming, I would really recommend watching our seminar series from last year, which was a more introductory, more of an introduction to secondary data. The series was called Building a Research Career Using Secondary Data, and is a 3-part series that walks you through how to use secondary data at each part of the research life cycle, including getting started, strategies for grant writing, and advanced analytic approaches. So I will also send those links around to watch again as well. This is a new, exciting opportunity that we're excited to announce, an opportunity for folks to come together and be together in person, and meet like-minded researchers and make some new connections. We are going to be hosting a speed collaborating event for this community of people who are interested in secondary data for mental health research. This is happening on Friday, May 8th from 9 to 11 a.m. We know that in doing these webinars, we can't see you and you can't really engage with each other. So there's not much opportunity for connection and collaboration. And just in general, in today's world where people are working remotely and often quite disconnected from each other, we really wanted to provide a space for like-minded people to connect and chat about their shared interests, shared research experiences, hopefully come up with some new research ideas and make some new connections and potential collaborators. So you have probably heard of speed dating before, which I know doesn't have the best reputation. So this is a similar format, but hopefully a little bit more fun, less torturous feeling. It is meant to be very low stakes and very casual. There will be a mix of short group discussion and one-on-one conversation for a short period of time, about 10 minutes or so. And then you'll rotate and meet someone new for about 6 rounds total. And there will be also some time to meet with our team and some other folks at the Depression Center that can help support your work. So we hope that you will join us. Again, that's going to be on Friday, May 8th at 9 a.m. It will be at the Rachel Upjohn building on North Campus, which has ample free parking. And we will also provide breakfast and coffee. So 2 more incentives for you to come join us in person. We will ask that you register for that in advance. So I will send around the link to sign up for that as a follow-up as well. Other ways that you can get more support from our team if you're working with secondary data, the first would be to apply to be part of our Research Incubator program. This is a program that offers hands-on support from our team for secondary data projects related to mental health that are led by early career scholars. So that means pre-tenure faculty and postdoc trainees. This is a really fantastic way to get more support and experience working with secondary data and to collaborate with our team. So it's something to look at, especially if you feel like you have limited funding or protected time for research, or don't have a research team and kind of lacking research support or infrastructure. You can get the support of our team for no cost to you. So applications for this program are going to open up in the fall. We will host an information session if you'd like to learn more. And if you're on this call and would be eligible to participate, I will send you the information when it's available. We also offer a range of written resources that you can review on your own time that are on our website, including a dataset library where you can review different secondary data options for mental health research. We have some tutorials, coding examples, some project management tool templates on our GitHub page. And you can also request a one-on-one consultation with our team. If you're looking for data, if you need some help with your analysis, or you just don't know where to get started, we are always happy to help you and chat with you. That's available for no cost, and you can request that on our website as well. Finally, just wanted to point to some other resources that are available across campus. There's many, many places to go look for help, but specific to secondary data work, the first is ICPSR, which is a massive hub for pre-existing data, really a global leader in archiving data and home to many, many great data sets, including HRS, which we talked about in our last session. They also offer a lot of great trainings and resources, such as their Summer Institute in Quantitative Methods. So just an excellent place to go if you're looking for data or looking for more training with secondary data work. U of M's Data Office for Clinical and Translational Research oversees some self-service data tools like Data Direct, which provides access to the University of Michigan MyChart data record, and also eMERSE, which gives access to clinicians' notes. And that would be the place to go if you're looking for access to either of those tools. And then finally, the Institute for Health Policy and Innovation, IHPI, offers many policy-related data resources and analytic assistance, and are also a really fantastic resource. So thank you all for listening. That was my last slide. And with that, we can get into questions. I will just go from the top in chronological order, but if people have additional questions, please feel free to submit them. I think this question is for Sung Kyun or whoever wants to answer. Does NHANES replenish the sample each cycle? In other words, is there an overlap of people participating in 2 consecutive cycles of NHANES?
So yeah, this is a good question, and actually the short answer is no. So if you look at just like a 2 consecutive cycle or even 3 consecutive cycle, because when NHANES select like a randomly select the county, so they try to avoid any overlap in consecutive cycles. So I am not 100% sure. Like if you look at, let's say, the cycle apart like over 10 years, and then if there's any overlap, by looking at these 2 like the 2 different cycles that are apart for many years. But if you look at just the 2 or 3 consecutive cycle, then it is fine that there will be no overlap.
Can I just add to that? Because I think it's a great question. The other thing, so while there's no overlap in like the survey data collection, there if what this question is about the potential for like longitudinal, like understanding how did people end up, there is the ability to answer questions that are longitudinal in nature. For example, Dr. Park's question of looking at lead exposure and then future claims for Alzheimer's disease and Medicare is an example of a longitudinal design. Similarly, NHANES, I don't know how far back they go, but is linked to the National Death Index, so you can look at mortality data. So, okay, somebody had, depression in their 20s, were they more or less, what was the likelihood they had premature mortality or died of, a heart attack or a stroke or something like that. So, while you can't look at the survey data longitudinally, you could there is an ability to look at people's future outcomes, if per se, using some of the linked data that does follow people going forward in time. And I would say this is distinct, especially for the measures of depression. The only other survey that kind of has good measures of depression like this is NHSDA, the National Survey on Drug Use and Health, which does not link back to other data sets. It's collected completely anonymously, and so it's not possible to link to mortality outcomes or Medicare outcomes, for example. So even though this isn't like the best quote unquote depression measure, because it has, no study is perfect, right? And so I just want to emphasize that there is an ability to look into the future, but as Dr. Park said, it's not the same people each time, but you could look into the future at mortality or maybe service utilization.
Great. Thank you both so much. Next question for whoever wants to answer. How clean are these data once you download them? How much data cleaning and management is typically required?
Yeah, this is another good question for those who start, this data first time, and then, data management, data cleaning is a big part of, any research when you begin. And so, like as I mentioned, and as I introduced earlier, so there are like five types of data. And so if you open just demographic examination and then, laboratory, most of this data are very clean. So not very much the like a data cleaning process is required. The major problem is if you open questionnaire data, then you have to be very careful because some of you who are designing your instrument, then you understand so how you design the design your instrument. So sometimes you don't need to collect the data from not from the entire population. For those who answer certain question no, then they have to, so they don't need to answer any follow-up question. Then they skip all that remaining question and then go to the some certain the next part of the question. So then if you don't, clean this skip pattern or any like those who answer like refuse to answer, then those answers are coded in certain level value instead of actual the answer value. So in that case, you have to clean the data. So that's why the short answer is mostly data is clean, but the question data require special attention, and then you will need to clean the data before you actually analyze the data.
Great, thank you. I actually want to call on Emily from our team to share her thoughts. We're in the middle of a project that's using data from NHANES, looking at ultra processed food and some of the dietary information in there. Emily, do you want to share your experience with cleaning the data? I know you're still in the middle, but you might have some things to share.
Sure. Yeah. I'd say the biggest hurdle is just the number of files that you'll have to download. It's all divided into different sections. So there's like depression. There's for the project that we're working on right now, we have to divide it into different sections. Like we're looking at sleep, CRP. Like C-reactive protein, there's a diabetes questionnaire, medical conditions, and those are all different files that you have to basically download. And once you get them downloaded, they're pretty small. There's only a handful of variables depending on which file you're looking at. So they're pretty easy to use once you have them downloaded. But if you're doing that and you're doing several several cycles, it's going to be a lot to kind of put together and just make sure that you're harmonizing across the cycles. So I do recommend if you use R, I think there's probably something similar you could do in Stata, but you can actually read the data files straight in your from the site instead of going and pointing and clicking and downloading. You can actually just have one line of code that will download the file for you. So you can save yourself the time of doing that if you have a lot of different data files. So if you're interested in that kind of code, I can share that with you. Just reach out to us at our email address there. But as far as once you have them all together, I do feel like they're relatively easy to work with and well cleaned, like Dr. Park was saying.
Great. Thank you so much. We just have about 1 minute left. There's two other questions that I think we can answer quickly. Are there some variables that are protected and not available to the general public that would require a special request for access? Yes, Dr. Park covered that earlier in his presentation. If you weren't able to be there for that part, you can go back and watch this recording. But the short answer is yes, there are some parts that are restricted. And then there was a question about how do I find what has been published? It doesn't seem that there is a central repository of publications, and it doesn't seem that there is one that we're aware of, but we can do a little bit more digging and see if there's anything we might be able to send out afterward. But I think with that, we can end our presentation. Thank you so much to our presenters, Dr. Park and Dr. Mezek. It was really fantastic, and really appreciate you both sharing so much information with everyone. And thank you for all the attendees for being here. I will send a follow-up information with a bunch of, or follow-up email with a bunch of information for you, and we hope to see you at our event in May. And thank you so much for being here. Have a great afternoon, everyone.
Thank you. And thank you, Sung Kyun, for doing this. That was great. Really appreciate it. All right. Thanks, everybody.
Bye.
Thank you.